Hi, I'm Dr. Stephen Fry. I'm a gastroenterologist and I practice here in the Tri-Cities. Lived here for approximately 17 years. I am in a practice with Dr. Jeffrey Finvis. I'm a co-founder of the Digestive Wellness Center here. I grew up in Ohio and went to Ohio State for undergrad and medical school, and then I did a residency in internal medicine at Emory University. Following that, I did a fellowship at Georgetown University before moving here in 1996. I chose to go into gastroenterology because I was intrigued by the physiology of the GI tract. I always knew that I wanted to practice medicine as far back as elementary school, but when I did my undergraduate degree and was exposed to physiology, I realized there was quite a bit of that with regard to the GI tract and the liver. And then when I actually got into my residency program and practiced with my hands, I realized I was fairly adept at doing procedures, and this field offers both of those options as to being able to do endoscopic procedures as well as sitting in a exam room and speaking with patients about their clinical problems. One of the unique things about gastroenterology is that most of the things that we see and treat are curable, and sometimes some of the things that we deal with are actually curable right under our eyes with endoscopic procedures and therapy. So it's very nice to go out after doing a procedure on a patient and provide them with good news and know that we've made a difference in their life right then. Patients are referred to us for liver disease as well as diseases of the gastrointestinal tract. We offer endoscopy here at this center, both for the upper GI tract and the colon. We also offer Gibbon's capsule enteroscopy, which is a exam of the small bowel using a capsule that travels through the small bowel, taking pictures every half a second. This allows us to find obscure gastrointestinal bleeding at times. We also offer therapeutic procedures through endoscopy where we can perform dilations of strictures. We offer pH testing where we're able to actually implant a device in the esophagus temporarily that sends information to a monitor without the use of a catheter that can be very distressing to some patients. We perform esophageal manometry here at this office, which allows for measuring motility disorders within the esophagus. We also offer a halo ablation technique for Barrett's esophagus, which enables us to literally remove Barrett's mucosa and reduce patients' risk for esophageal cancer. This is the clinic where we see patients in consultation. Patients are often referred by their primary care providers, and sometimes they come on their own. We strive to get patients into the office rapidly here. Typically there's not a long wait for any type of problem. In the event that you have a real urgent finding or problem, we're often able to see you literally within that week. We try not to make this an endoscopy mill, though. We want you to be able to come into the office and have all your questions answered before you actually get back to our endoscopy suite. We don't want you to be uncomfortable. We want you to feel like you trust us as your provider before you get there. We do value your time. We want you to be able to come in very quickly, have your procedure. Your results are made available immediately to you. In fact, they're faxed to your referring physician before you even leave the endoscopy suite to go to recovery. One of the common problems that patients are referred to us is gastroesophageal reflux disease. It's extremely common in the population. Everyone has heartburn occasionally, but when you experience it more than 2 to 3 times per week on a chronic basis, it's considered a disease. And when that occurs, you really ought to talk to your primary care provider about that. Everyone doesn't need to be referred to see us just because they have heartburn or require medication. But if you take medication for a long period of time, say for more than a couple of years, you might want to see us and undergo upper endoscopy. Patients that have chronic acid reflux are at risk for getting esophageal cancer. There is a precursor to esophageal cancer that can only be detected through upper endoscopy, and that problem is Barrett's esophagus. Barrett's esophagus is where you have a transformation of the lower esophagus with a new lining that puts you at risk for cancer. This can really only be detected through direct visualization with an endoscope. If you have alarm symptoms such as weight loss or difficulty with swallowing, you should have an upper endoscopy at that point and not wait. When I say difficulty with swallowing, I mean the sensation that when you swallow foods, it wants to stick in your chest and not go down. That type of problem should always be investigated, and if you have that problem, please discuss it with your primary care provider. Patients diagnosed with Barrett's esophagus are at greater risk for getting esophageal adenocarcinoma. This is typically something that's surveyed for through episodic endoscopy. We actually have a device here called Halo that can be used to ablate or get rid of your Barrett's esophagus. This has been shown to reduce your risk for esophageal cancer. For years, our staff has been complimented over and over again by patients as far as their caring way. We want to provide you with the quality of care that we would wish that our family would receive.